Good afternoon, I guess. Like she said, I'm Dr. Erica Stone. I'm an OBGYN here in Lake County in Tavares. My office is off of David Walker Drive. They asked me to do a topic on vaginal bleeding, uterine bleeding, something related to that. And it's a very broad topic. So hopefully I address some of the issues or questions you all have. If not, we can ask questions afterwards. So it's going to be kind of a quicker presentation than this topic usually allows. So I won't be able to get to everything, but hopefully I'll get to some of the topics that you all might be interested in. Abnormal vaginal bleeding is a very, very common complaint. It goes from anywhere from infants up to people who are 90 years old. In my practice, I've seen everyone with this complaint, being an infant, 10 days old, having vaginal bleeding, which is pretty common just due to the decrease in hormones they was getting from mom and things like that, up to a 99-year-old that was having some vaginal bleeding or spotting. I'm kind of try to go over this topic in kind of age range and things like that to try to address some of the specific things that's related to those different issues. Like I said before, infants and things like that, generally that's going to be due to right after birth, and that's going to be due to the decrease in hormones coming from mom. And sometimes after that, a little bit older, 7 and 8-year-olds, sometimes we get to come in with either vaginal bleeding or discharge and things like that. Those are usually going to be from something like a foreign body. We don't know how sometimes, but things end up in there for little girls all the time. So that generally covers those two age range. Other things that happens a lot of times with vaginal bleeding, let you know, what we talk about is, well, it's called menarche. Menarche is the first period that a female usually gets. Generally, that's around the age of 8 to 14. 16 is the latest we would let someone go without a menses, but that's the first thing you get. It's called menarche. After that, the first 5 to 7 years after they have a period, generally they're going to be irregular. They're going to be long, some of them be heavy and things like that. Generally, over that period of time, they start getting a little bit more regular just so their body's adjusting their own natural hormones. So we get a lot of 13, 14-year-olds coming in saying, you know, their periods are 5 to 7 days, they have to change their tampons very often and let them know. Generally, it's a pretty common thing and it's nothing to be concerned about. But if they are concerned, we can go further. But generally, it's just to let the teenager who probably just doesn't know anyone else who's having periods know that it's just like everyone else. To let them know we've seen tons of people like that, that it's nothing abnormal and you're just like everyone else. Generally, period after that, we see a lot of people coming in for abnormal uterine bleeding or heavy bleeding. It's around age of 40. That's what we call perimenopausal. That's a lot of people coming in, my periods are irregular. I get it every 1 to 3 months, and when I get it, I'm like flooding. I'm saturating tampons and pads often. I can't go to work. I have to change my clothes and things like that. That's also common. It's just like with a teenager. Your hormone levels are changing, and so they're not the same that you were getting before. So you have these irregular bleedings. But we're going to address those over time. The third and last area we're going to go over are people that come in with problems with bleeding. It's postmenopausal people. In the United States, the average age of menopause is about 52. So after that, generally most people have gone through menopause. And anytime you have bleeding after that, it's always a concern. So we see a lot of those in our office, especially in this community, since the average age is a little bit over that. So basically, like I said before, we go back to teenage. Irregular periods are very, very common the first year, especially for the first 5 to 7 years. What we're concerned about if people get anemic or when they have a low blood count because they're losing so much blood with their periods. Generally, the first treatment options for these girls are usually birth control pills, which are not just to control getting pregnant, but it also helps control your hormones. The birth control pills generally have 2 hormones, estrogen and progesterone, and they kind of mimic what your body should produce because generally their body is not producing that. If that's not causing it, or if the bleeding is very heavy, especially with their first period, what we call menarche, we also have to concern about bleeding disorders. That's things like von Willebrand's factors or people with platelet factors. And those are people who just can't stop bleeding. If they cut themselves, they can get this type of problem. A lot of times, the first time someone diagnoses is when they first start having their period because they just can't stop. A lot of times, these girls end up in the ER with hemoglobins and have to get blood transfusions and things like that. So those are the big ones you worry about in teenagers. The other issue that comes up with bleeding in teenagers is that they start having periods and they were fine, or maybe a little abnormal, and then they stop. And that's what we call amenorrhea or no more menses. Generally, the first thing we do in teenagers and in any age range, we have to rule out they're pregnant. And in our side, you know, that's pretty common to have that. If that's ruled out and we know they're not pregnant, but they're still not having they're still not having menses. The other things we have to worry about, what's going on in their life. Have they gained or lost any weight? A lot of times people will become athletes and they lower their body fat, and so then they can't have periods because their own body says it's not healthy for them to get pregnant, so they don't have those hormones coming in and out telling them to have periods. Another thing is people get stressed. I have a lot of teenagers coming in saying, you know, I don't have periods, and, you know, well, my mom and dad are getting divorced, I'm having a hard time at school, someone is bullying me, and things like that. So a lot of times coming to see me is the first time someone knows something's really going on with them that's outside of GYN. But a lot of times when we get those things under control, their menses usually returns and they start having normal periods. The other one is hormone imbalances, like I said before. They can have the irregular hormone imbalance just from their age, but a lot of times they have what we call polycystic ovarian syndrome, which is a disorder when your body's not producing the right hormones. You have a higher testosterone, or what some people consider the male hormone. And what they have, they have hair on their chins and on their chest, so they get a lot of male things. And then their periods can also become irregular. They can become, they'll have them every 1 to 3 months. Sometimes they have it twice in a month. And when they do have it, they have very, very heavy periods. And that's kind of the gist of what happens with teenagers. The other issue we address with them with vaginal problems or bleeding problems with teenagers is, what if they never get a period? We have a few people who were 15, 16 coming into office like, you know, everyone else in my class or in my area has had a period, but I haven't. So we have to rule out, okay, so why hasn't this happened? Generally by the age of 16, everyone should have a period. Generally, if it's a little bit younger, you have to have what we call some of the secondary sex characteristics. If we have a little girl who's coming in and she's 14 and she doesn't have breast buds and she doesn't have any pubic hair, we start thinking of other things. But by 16, everyone should have it. So if it's not, we really start to look at what's going on. And sometimes you can have that they're actually having a period, but there's something blocking it from coming out. And that's what we call imperfect hymen. They actually have a tissue that's going across that they're having a period, they're having to build up a blood behind it, but they can't get it out. And so a lot of times with that, they'll come in complaining of abdominal cramping and things like that once a month, just like a regular period, but nothing ever comes. And that's generally easy to diagnose. You look down and you see there's actually a piece of skin, looks like sometimes a little skin that's coming across. And that's pretty easy to treat. Take them to the OR and you cut that tissue, and they're usually a lot better after that. The other thing, sometimes people can have other anatomic problems, and that can be like somehow during development they actually fail to develop the organs that they are supposed to have, and sometimes they'll not have a uterus. So of course, if you don't have a uterus, you can't build up that lining and bleed, or sometimes there's a disconnect between their uterus and vagina. So they might be forming things in the uterus, but it can't get out. So that's some of the other things that's kind of going along with that age range that doesn't go to the other people. Let's see, so after the teenage years, generally the next area we go to are what we call the reproductive age women. That's usually women generally 18 to about 35 to 40. That's the largest patient population we come in complaining of heavy periods or irregular periods. So what are the things that if you are having any problem, you're worried, like, should I see a physician about? Some of the things you're going through, if you're soaking through your tampons or pads about once an hour or once every 2 hours, you generally should be seen. If it's about once an hour, you probably should be seen in the ER urgent care center, because that's a lot of blood to be going through in an hour or so. If you have to use 2 pads or tampons during your period, that's also something should be seen. There are people I've seen, I've been having this problem for the last 10 years, but they have not seen anyone because everyone else in their family have that problem. Just because everyone else has that problem does not mean it's not a problem. And that's what we try to make sure everyone knows. When you have that doubling up on pads, it's not normal. So come and see someone if that's a question. A lot of times if you wake up in the middle of the night and you notice your entire bed is flooded, you probably need to see someone about it, because that's also not the average, and it's something that you should be seeing someone about. There are tons of people that this happened with, and it's not that something's wrong with you, it just means that we need to figure out what's going on while you're having this problem. A lot of times people also, they develop and they pass a lot of large blood clots when they're having their period, and that's also a problem. You pass in a lot of blood clots, that means you're having a lot of bleeding, and you really should be seeing someone about that, because a lot of times, once again, you're losing a lot of blood and you become anemic. You can become anemic and things like that. Also, if you have to change your activities because of the heavy bleeding, like, you know, you have a sports event, you don't think you can go because, you know, I'm going to be on my period, that's a problem. You shouldn't have to do that when you have a normal average period. And if that's a problem, if that's something that's going on, you really should see someone to help try to get that under control. The other one is having symptoms of what we call anemia, low blood count, which some people have at different points in time. But if you're having tiredness, fatigue, and especially shortness of breath, or you just feel your heart racing a lot and things like that, and you have this heavy bleeding, you really should be seeing someone. And if you have those symptoms, you probably should be seen in the ER or urgent care center to see what's going on, because you might need a blood transfusion or some of the other problems that can develop. So what are the causes in this age range? We talked about the teenagers, and you realize there's a lot of things that go along with teenagers that go along with this age group, which are basically the same. One is called a hormone imbalance, like we talked about before. In a normal, menstrual cycle, you have hormones, estrogen, progesterone, they're produced in different levels that make your lining of your uterus grow, and then hormones will drop and you have a period. Generally, that should be about on average every 28 days. If there's a hormone imbalance for whatever reason, like we said before, stressors and things like that can cause that. Generally, you can have irregular periods where your periods last longer than that. They can last somewhere between 7 to 9 days, or maybe your periods come every 35 to 40 days, or they're coming every 15 days. And those things are not the average and they're not the norm. So maybe you should be seeing someone about that. Other causes that can cause you to have some of these things are what we call dysfunction of the ovaries. Your ovaries are the place where a lot of women produce the majority of their hormones. Estrogen, progesterone, testosterone, things like that. A lot of them are formed in your ovaries. So if there's something going on with your ovaries, it can cause some of these problems. A lot of people say, well, I have a cyst on my ovary. Cysts on your ovary are generally pretty common. Every month, women form a cyst on their ovary, and it's not generally a big thing. Now, if they get very large, come and see someone and things like that. But a cyst that's 2 to 3 centimeters or something like that, completely normal. But sometimes if your ovaries are malfunctioning in other ways, you can have some of these problems. Another thing that people come in and see us about, and the reason why we find they have irregular or heavy bleeding, it's called uterine fibroids. Fibroids are kind of, we call like a mass in your uterus. It's usually kind of a muscle cell that kind of going out of control. We still don't know why people have uterine fibroids. And if someone figures that out, you have a Nobel Prize waiting for you, because a lot of women will be ecstatically happy if we figure out why we have fibroids, because they do cause a lot of problems with women. They generally can cause a lot of heavy bleeding. They can cause pelvic pain. You can have problems with getting pregnant because of the fibroids and things like that. But a lot of times they can cause bleeding. But there are sometimes you can have fibroids and you have not a single problem in the world. So just because you have a fibroid does not mean you have a problem, because it's very common among many people. But it is a common cause of irregular bleeding in women, especially in this age range. Other causes, what we call adenomyosis. Adenomyosis is where that lining of your uterus can grow into the muscle of your uterus. A lot of times you can have bleeding problems, but a lot more times with that, you have pelvic pain. And that's usually the one thing that goes along with that. Adenomyosis is kind of difficult because it doesn't respond to a lot of the treatment options we have for other things. And a large part of people with this generally go on to have a hysterectomy for that, instead of some of the other options that we have for people with, say, uterine fibroids or hormone imbalances and things like that. Sometimes people will get an IUD either for contraception or because they're having bleeding problems, and they say, I got this IUD, it's been there for 2 months, and now I've just had the worst bleeding of my life. It just won't stop. And generally what we tell them, it's completely normal. The first 4 to 6 months with IUD, you can get cramping, you can get bleeding, you can have irregular cycles and things like that. It's completely normal. The great thing is about that, after those 6 months, the IUD is one of the best forms of birth control imaginable. It's actually one of our treatments for irregular or heavy menses. But the first 4 to 6 months can be a little, abnormal. So we have to tell someone when they get one that these are the things that can happen. So if that happens, don't be too alarmed. Now, if you have signs of anemia or large blood loss, let us know. But cramping, a little bit heavier bleeding, and periods a little bit longer, completely normal with that. Sometimes other things you worry about in people in this age range, which we call the reproductive age, is because they can get pregnant. So you're worried about pregnancy and pregnancy complications. I had a patient came in, it's like, I just haven't had a period in the last 2 to 3 months. And we're like, really? Are you having sex? Yeah. Using condoms? No. So what do you think's going on? Could it possibly be you're pregnant? Well, I guess so. And this person's had 2 or 3 kids before. So that's why it's one of the first things we rule out when anyone comes into our office, anything related to bleeding whatsoever. And like I said, the youngest patient I've delivered since I've been here was 15. So we don't think just because they're younger that they're not having the same things that are going on. And the oldest patient that came in was pregnant was 46. So anywhere in between that this can be a common complication. So they can come in for no bleeding. They can come in because my periods are irregular, or sometimes they come in for heavy menses with that, and it's because they're having a miscarriage or another complication of pregnancy. So that's one of the big things we have to rule out when someone comes in for that. The other issue is cancer. In this age range, cancer is not very common in a reproductive age, but it is one of the symptoms of cancers. In general, in this age range, sometimes they can have cervical cancer. Cervical cancer, as we talked about in previous discussions, is generally a cancer caused by a STD, or sexually transmitted virus, called HPV. It changes the cells on your cervix and become irregular, and over time, if you don't get treatment for them, it will progress or can progress to cancer. Some of the symptoms of that one is going to be irregular bleeding or bleeding after intercourse and things like that. That's a whole large other topic. We'll talk another day, but that is one of the things that people come in for irregular bleeding and they end up diagnosed with cancer of the cervix. Other cancers that can be diagnosed in this time with that, it's going to be endometrial cancer. It's generally not a very common cancer of someone in a reproductive age. So we'll talk about that more. We talk about postmenopausal bleeding, but it is something we have to rule out. And that's why anyone over the age of 35 who comes in for irregular, heavy periods, we have to do something we call an endometrial biopsy, which sounds a lot worse than what it really is. We basically take this little itty pipette, place inside your uterus, and we sample some of the cells, in your uterus to send to pathology. So they can say, really it's just, sometimes they can tell it's a hormone imbalance, but sometimes they say the cells are a little irregular, so we need to look further at that. So because it can be diagnosed in someone as young as that, anyone with the age of 35 who has heavy bleeding should have endometrial biopsy. Once again, just like in the younger girls, sometimes they can have bleeding disorders, but generally they know about those bleeding disorders. Sometimes we get those people come in because they stop taking the medication they're supposed to take for their bleeding disorder, and so now they're having heavy periods. And sometimes just well, we already know what the issue is, let's adjust it. Usually by reproductive age, they're diagnosed already with some of those, but if there's not, we found a few that weren't diagnosed before, and we're able to find out that's why they were having the heavy bleeding, and we're able to get that under control. Medications. There are some medications that can cause your bleeding to become irregular and heavy, and the main culprits are what we call NSAIDs, or non-steroidal anti-inflammatories. We all have some of those in our closet or in our medicine cabinet, so we all know, what those can do. Usually it's medications we take for headaches and back pains and things like that. Common things, if you take that on a regular basis, they can cause irregular bleeding. Let's see. Other conditions that can do that. A lot of times, thyroid disorders can cause irregular bleeding. That's when someone comes in for heavy bleeding, one of the first things we do is look at their thyroid hormone. Because if your thyroid hormone is too high or too low, you can have heavy or irregular bleeding. And if that's the case, that's pretty easy treatment. You just, give them back the thyroid medication so they can get back to the levels they need, and usually that can help treat their problems. Other things can be due is infections. If you have an infection inside your uterus or your cervix and things like that. And one that we talk about is PID, or pelvic inflammatory disease. And that's generally an infection that started either in your cervix, vagina, that got into your uterus and then crawled out through your tubes into your abdomen. And that can cause infections. A lot of times with that, the major complaints they have is pain or vaginal discharge. But a lot of times they can come in for bleeding problems, and then we can diagnose them with PID or pelvic inflammatory diseases. Also, other disorders that can cause heavy bleeding and bleeding problems are liver and kidney diseases. The liver controls a lot of things that are going on with your body. If your liver's not functioning, it actually makes a lot of the clotting factors that we need to stop our blood from to actually perform clots. So if you have bad liver disorders, you can't clot your blood. So of course you're not going to be able to stop bleeding if you can't clot your blood, because that's how we stop any bleeding. But generally they will also have other problems. They cut themselves doing something else, they'll have heavy bleeding. They usually get jaundice and things like that. But both of those things, the kidney and the liver, can also contribute a lot to bleeding problems. So we also looked at those when people come in complaining of problems with bleeding. So treatment options. So you're somewhere between the age of 18 and 35. If you're not considering having kids, some of the options we have is number one, IUD, which we talked a little bit about before. It's a little T-shaped device we put in your uterus. It's one of the best treatment options we have because it's, you don't have to remember to take something every day. It's pretty well affordable considering it's something that it's over 5 years, so it costs about it's I believe it's like $800 for the total thing, but over the course of 5 years, it's less than $50 a month, which is pretty nice for contraception. And most people with insurance, it's a lot less than that. But IUD, especially the Mirena, it actually has progesterone in it, and releases a little bit of progesterone every day, so it makes the lining of your uterus a lot thinner. So when that happens, you don't bleed as heavily, and that's a great option for a lot of people who are not considering having kids. And also just a great option for birth control in general. Like I said, my nieces are going off to college, and for their 18th birthdays, they're both getting IUDs. So it helped them not have periods, and I don't have to worry about any phone calls while they're away. Other treatment options are OCPs, or what we call oral contraceptive pills, or as a lot of people call birth control pills. Like I said before, birth control pills are not just for contraception. Because they have the same hormones that our body produces, it also helps regulate your periods so that you don't have the heavy, long periods. The great thing about birth control pills is they work for a lot of people. The bad thing is about it, you actually have to take them every day for it to work. So that's the thing you get a lot of people. You start them on the birth control, and then they're like, well, I'm forgetting every day and things like that. So it's sometimes not the best for a lot of people, especially the younger populations who can't remember to take it every day. So what we generally tell a lot of people, if you set a reminder on your cell phone to go off every day, because generally everyone has their cell phone with them, that's one way to remember to take your birth control pill. Or have it by your toothbrush, because most people, hopefully, do brush their teeth every day, at least once. And so that's one way to remember. Another option is similar to the birth control pill, but it's actually not a pill. It's called NuvaRing. It's actually a ring-shaped device, about that big. It's very pliable and flexible. You place it in your vagina, you leave it there for 4 weeks. You take it out, you have a period. The great thing about that, you don't have to remember taking it like the birth control pill. You also don't have to go through your GI tract. So some people who take birth control pills can't take the side effects. They get a little nauseous and things like that with it. With the NuvaRing, you don't have that. So that's a great option for those people who have that problem with it. Another bad thing about all those medications with the estrogen and progesterone, particularly estrogen, you do have to worry about blood clots. So anyone who has a history of a blood clotting disorder and things like that, generally those medications are not going to be the best for them because they do have to worry about the blood clots. It's not very common in those age ranges, but it is something we do tell everyone about who we start on that medication. Let's see, other medications that we have for that. There is another medication, and for the life of me, I cannot remember its name right now. You can take, it's actually just for heavy menses. You take it at the start of your period, and you take it for 7 days, and generally it will decrease your bleeding profile. The great thing about that, you don't have to remember to take it every day, because you only take it when you're on your period. And generally, if you have heavy periods, you're going to remember to take that medication because you know you really don't want to have a heavy period during that time. The bad thing about that, it doesn't have any extra benefits like birth control options. So if you take it, it's just for your heavy bleeding, and it's not going to prevent pregnancy and things like that. And in reproductive age women, we believe every pregnancy should be planned. So if they're not using that, they will have to use a second form of birth control, unless they've had some other permanent thing, husband vasectomy, which I think is the best birth control known to man. And I hope every male gets a vasectomy when they want no more children. But that's always an ongoing fight. Or condoms, which is also a great thing. Like I always tell everyone, we have a bucket of condoms at our office. So if you ever need some, no matter who you are, you're a patient or not, please come and get a handful. We don't care. We fill them up completely. Just use them. That's all. And not for balloons or anything else. Because we're trying to decrease the number of unintended pregnancies as much as possible. So we try to prevent that. So that's the big thing about the treatment options with for heavy bleeding. The other options sometimes for people, we've tried these things and it's not working, or if you come into the ER, we've had multiple phone calls, well, this patient is bleeding, we cannot stop them from bleeding, it's 2 o'clock in the morning, guess what, we're going to the OR for a DNC. That's called a dilatation, and curettage. So we basically go in, kind of open up the cervix a little bit, just get an instrument, and we basically scrape the uterus to take the endometrium down since it's still bleeding. A lot of times that will stop the bleeding or at least get it under control rapidly for people who are showing signs of anemia and the bleeding is just not stopping. A lot of times that's also used for people with miscarriages and things like that. So you might have heard it used in other forms, but that's also an option. Another option on there that's surgical, it would be an endometrial ablation. Endometrial ablation is where we go in and there's different forms. There's one where actually you microwave the endometrium or that lining in uterus to stop it from bleeding. And those are usually going to use for people who are done with childbirth. Because once you have that done, you really should not be trying to have another child because generally the lining is going to be too thin for that. But that's a great option for people who have heavy bleeding and who do not want to have any more children. With that, like I said, there's one where they actually microwave the lining of a uterus. It's not as bad as it sounds because it's just a little thing that's shaped like a uterus. It goes in there and kind of gets rid of that endometrium. There's other ones where you go in and you basically put hot water into the uterus and it basically destroys the endometrium that's inside that causes the heavy bleeding and things like that. There's one actually what we call cryotherapy, where they basically freeze the lining of the uterus. So you can freeze it, you can cook it, you can microwave it, you can do whatever you want. As long as it stops bleeding, we don't care. But those are kind of the common ways with endometrial ablation that's usually used to stop some of the heavy bleeding. So let's see. The other thing, which I know in this population here that's going to come up a lot that can cause some heavy bleeding things, is called what we call uterine polyps. Uterine polyps are like kind of an overgrowth of a cell that's started in your uterus, and it grows and it comes to look like, if anyone had a skin tag or something like that, it kind of looks like that. I think I have a picture here. If you see here, these are polyps, and they can happen anywhere inside the endometrium. This is at the fundus, and they can fall down or side. Sometimes you can get them where they're further down and they can grow. They actually will fall down into your vagina, and what we call endocervical polyp and things like that. And those can cause heavy bleeding, or they can just cause irregular bleeding. A lot of times people, especially with the ones that fall into the vagina, they have bleeding after intercourse. They'll come in like, I'm not sure why, but you know, I have intercourse and I just spot for 2 or 3 days afterwards, and it doesn't happen unless I have intercourse. And that's usually a lot of times we can find it's that. Other times with people who come in with that bleeding after intercourse, they can have what we call cervicitis, or inflammation of their cervix. It's usually a benign process, so it's not something to be too concerned about. And a lot of times it's not related to HPV or the cancer-causing virus, but it can cause bleeding, actually bleeding after intercourse, or just bleeding in between periods. So back to polyps, as I said before, like I said, they're just a kind of overgrowth of cells that will start off endometrium and kind of grow out from there. And they can be very, very small, or the size of like a sesame seed, up to the size of a golf ball. I've never measured the biggest one we've taken out, but they can be pretty large. They can fill the entire endometrium. Generally, they don't get to be that large, but they can. You can have anywhere from between 1 to a numerous number of polyps. The number of polyps doesn't always correlate with the symptoms that you're having, nor do someone can have 1 polyp and they're bleeding like a stuffed pig, as they say. And some people can have 5 polyps and they might have some spotting, so we never know. So we can't figure out the reason why someone is having bleeding and things like that. Sometimes we have to go in and look, and a lot of times you can find uterine polyps. They generally, like I said, is going to occur in older populations, usually 40s or 50s, and people in postmenopausal, or the next age range we're going to. So that's the next word, postmenopausal bleeding. It's something we see a lot in this area because of the age of people we have here. Generally, like I said, menopause in this United States is usually around 52. So anyone after that, you have 1 year of no periods, that's called menopause. So if you had 6 months of no periods, you had a period, you got to start all over generally. Now, just a little spotting, we can say, okay, but generally 1 year of no periods, or you have lab results that show that your hormones are showing you're in menopause, that's called menopausal. You have any bleeding after that, you need to see someone regardless if it's 1 time, if it's 5 times, what have you not. Don't think, oh, well, it's nothing. I just think, you know, I cut myself something. Just get checked out, because a lot of times it is like nothing, but a lot of times it can be something more serious, and that's what we're going to kind of go over today. A lot of people who come in who are postmenopausal, who comes in for bleeding, they have what we call atrophy. That means they're in menopause, so their ovaries basically are not working and functioning and not producing the hormones they need anymore. So they don't have that estrogen and progesterone. So the lining of their uterus gets very, very, very thin. And it can bleed if it gets, anything happens to it, things like that. And that's a lot of times women who are 80 and 90, or even a little bit younger, 50 and 60, will come in. I've had some bleeding, you know, go in and look inside with the camera, and it's atrophy. The good thing about that is generally there's nothing you have to do about it. Some people, we do put them on hormone replacement to try to help build up that endometrium, because if not, they can have more bleeding. And even though if you get no treatment and it happens again, do we say, well, it's probably just the atrophy, or do we not know if something grew since the last time we were there? So that's the bad thing about not doing anything. But that is an option. So a lot of people are atrophy. We put them on estrogen and progesterone generally to help just get a little bit of hormones in that to help grow that endometrium so it's not so thin that it will bleed irregularly. The other thing that can happen with those patients is what we call the polyps, you know, things like that. Polyps are generally benign. That means they're generally not cancerous. But sometimes polyps can be, most of it can be benign, and then you have a little area that's showing a little precancerous or cancer lesions in there. And so with polyps, generally we always take them out. So you go in, you take all the polyps out and things like that. We send everything to pathology, and they say, you know, they're completely benign, nothing to worry about. So basically we tell the women, there's nothing you really have to do. Just keep an eye on it. If you have any more bleeding or anything like that, we'll work you up again. But right now you're okay. Sometimes if they do have other things in them, like what you call hyperplasia, or when the cells start growing uncontrolled, and so that sometimes can be considered a precancerous thing. Then you have to start thinking about treatment, and so sometimes you can either do high-dose progesterone to help with that, and that's one of the 2 hormones your body produces, or sometimes people say, you know what, I really don't want the risk of this, I just want take the uterus out, so I'm not worried about endometrial cancer, which is related to the hyperplasia or cancer. Or other times people come in for bleeding and we do either a biopsy or we have to go to the OR and it actually comes back cancer, and that's usually cancer of the uterus. Uterine cancer is pretty common in this age range, considering these are people a little bit older, and cancer in general are more common in that age group than any other age group outside of cervical cancer in my area. At this hospital, we do not have a gynecologist, so generally if someone does have uterine cancer, we send them to Orlando to see the gynecologist for referral. And a lot of times they say, you know, you do have cancer, but it's a very low grade, so your physician back in Tavares can do surgery for you to help that, or sometimes they might need to do surgery in Orlando, because with cancer, not only you have to take your uterus out, you also have to take out what we call lymph nodes, and these tiny little rubbery things that goes throughout your body that drains fluid without your body. If the cancer starts to spread, it can spread to those lymph nodes. Most basic or GYNs like I am, we are trained in doing hysterectomies and things, ablations and things like that, but we do not do the additional training in cancer gynecology, so you usually will go to a specialist for that. Sometimes here there are patients who can't travel to Orlando, and so that case you have a gynecologist and a general surgeon who operate together to take everything out. The gynecologist will do the hysterectomy and take out your ovaries if needed, and then the general surgeon will have to take out the lymph nodes and things like that, because when you're taking out lymph nodes, you're going deeper into different areas. You're worried about hitting blood vessels and things like that. So they are more complicated surgery, which is why gynecologists will then have additional 3 to 5 years in training for that. So that's generally what happens with that. But hopefully no one gets to that point where they have uterine cancer, but we know it is possible. So that's all I have for you all. Hope it was a very, very broad topic, but I hope I got kind of the main thing of what everyone had questions about, and I will take questions. Someone asked if they had a hysterectomy when they were younger and they removed their uterus and possibly 1 ovary, so they're left with at least 1 ovary. Do you go through menopause at the time of surgery, or do you go through later? Generally, menopause is controlled by your ovary. So if you have at least 1 ovary, it's going to be controlled by that ovary and how it's functioning. So you won't go through menopause at that time. Generally, people who've had a hysterectomy, they can go through menopause a little bit earlier than people who did not have a hysterectomy, because there is blood flow going from your uterus to your ovary. So if you cut off that blood flow, sometimes that can decrease the age or go through menopause, but generally it's set by the ovary. The question is, a long time ago, that people would get a hysterectomy if they found that they had polyps in their uterus, and is that the standard of care? Actually, that's a question between that physician and the patient, because sometimes they might have polyps, but they might have other problems. But generally, if you have benign polyps, you know, you do not have to have a hysterectomy. Generally, we can remove the polyps and watch and see what happens. Sometimes they'll place you on hormones or not, things like that. But it's not that you have to have a hysterectomy if you have uterine polyps this day and age. Nowadays, we've kind of moved away from everyone getting a hysterectomy if they cough the wrong way, because there were times that everyone got a hysterectomy. But nowadays, we kind of got away from that. Like we said, we do more ablations where you leave the uterus, but you burn the lining, so people with heavy bleeding. Because I know a lot of patients who come in, I had a hysterectomy for fibroids or for heavy bleeding, things like that. And nowadays, we kind of try to control that with other ways. And so surgery is generally a last resort after everything else has been exhausted. Okay, I think we answered all the questions. Well, thank you for joining us.